All right, let's step away from the race for numbers a bit. And the Kenyan Doctors Union officials and the Health Cabinet Secretary Cleopa Mailu today held a meeting that lasted over 5 hours to discuss the way forward concerning the doctors' strike. However, when they came out of the meeting, they gave journalists the silent treatment as sources revealed that there might be another session of talks tomorrow. Our reporter Nicholas Wambua has been keeping tabs on the doctors today and now joins us live from our city center studios. Nicholas, you have been staking out the whole day. Has there been any word of any progress whatsoever on the talks today?
Thank you very much, Ben. And today marks the 44th day into the doctor strike, a day that marks suffering for most of the Kenyans who have been able to visit the public hospitals and, to an extent, some private hospitals with no treatment or with no service from the doctors. And today, Cleopa Mailu, that is the Health Cabinet Secretary, together with the doctors' officials, and held a meeting today to discuss a way forward into the doctor strike to see whether they can end it. And then today, it could be a hope, a sign of hope, hope to Kenyans that at last the CBA that is between the doctors and the government, that the doctors want to be signed or to be signed by the government as they agreed in 2013. Then for the first time, it was discussed in this meeting between the Cabinet Secretary and the doctors' officials. That is according to the reports that we're getting. And today in the meeting, although they did not disclose, it's like it was an agreement that they do not disclose what happened in the meeting. It is rumored that this CBA will discuss, and further discussions could continue tomorrow and come Thursday. That is even as Mombasa Senator Omar Hassan and Makueni Senator Mutula Kilonzo, who is also said to be part of the legal team of the doctors, urged the county governments and the Council of Governors to ensure that they do not, or they drop any sanctions onto the doctors and any threats that they issue to the doctors, that they are going to drop the doctors and maybe order or call upon Kenyans who are willing to apply for their jobs to take that step. But then they say that this is a step that is going to move us back, since this does not solve the problem. So Ben, right now, as it stands, we still do not know where the strike lies and whether it is going to stop or not. But then the discussions coming tomorrow and maybe Thursday, then they are going to inform us further. Back to you, Ben.
All right, Nicholas, very quickly, it has been 44 days, as you mentioned, of hardline positions by both sides. If we are indeed maybe seeing some progress, which side holds the key to, solutions to these talks?
Ben, as you can remember, what the doctors want is the CBA that they came in agreement with the government in 2013 to be signed, or to be effected by the government. But then, as you can remember, last week in court, Judge Wasilwa said that the CBA was non-existent. And therefore, that to some extent brought the doctors' hopes down, because this means that what they have been calling for, or what they've been asking the government to do then, is nothing that is, it is not in line with what they want. Because if the CBA then is not, if it is not existing, then it means that there was no any agreement to take place between the doctors and the government. But then again, Cleopa Mailu, the Cabinet Secretary for Health, today now talking about this CBA with the doctors, it means that it is still in line. And therefore, it means that it now lies between the Cabinet Secretary, Cleopa Mailu, and the doctors. If they discuss the CBA, they come up with an agreement to agree or to disagree whether they are going to effect as the doctors want, or they are going to ignore it. Then that means that if they do not agree to what the doctors want, that means that after the 2 weeks, the doctors go back to court. But then if they agree, if Cleopa Mailu or the government agrees to what the doctors are calling for, then it means that they are going again to make sure that the doctors get what they want, or rather, they're going to get what they agree in the meeting. Back to you, Ben.
Thank you, Nicholas Wambua. They're following that story for us. Remember, sources telling us that there could be another round of talks tomorrow. Now, it is a